What are terpenes? Terpenes are molecules that are made by a bunch of different plants. Cannabis makes terpene molecules, citrus plants make terpene molecules, evergreen plants make terpene molecules. Terpenes are made by a lot of different molecules, including cannabis. They do have a medical effect, even at very low concentrations. And terpenes and cannabinoids actually share similar precursor molecules, so that they're made from the same basic ingredients, and the plant's biological systems end up making different molecules. It's the terpenes that are responsible for the smell of marijuana, its flavors, because the cannabinoids THC and CBD don't have any smell to them. So when we are smelling the terpenes, whether it's a lemon kush or it's a very piney fragrance, those are the terpenes and not the cannabinoids. Terpenes are common to human diets. They are listed by the regulatory agencies as generally recognized as safe. They behave very safely, have a long history of use in humans. Topically, they're very safe fresh. There can be some minor irritation if the product is old. Terpenes can sometimes, on rare occasions, cause minor skin irritations. Nothing ever harmful happens from them. What they do is they interact with different enzyme systems in the body, neurotransmitters, second messenger systems, and these are part of the ways that they create physiologic effects. The cannabis plant can have very wide variety of terpene expressions, even within the same plant itself. Terpene concentration will vary throughout processing. It can actually, the terpene levels can raise as the plant dries. And also, as the plant ages, it loses, as the dried flower ages, it will lose some of its smell. Those are the terpenes. So that when you open a nice new jar of really smelly flowers that can kind of permeate the room, those are the terpenes literally leaving the plant and going into the air. They do have medical benefit at very low concentrations. And the plant, because of the way it uses them, will be fairly variable. For example, upper leaves. Upper leaves tend to be preyed upon by insects a lot of the time. So the plant will put out anti-insecticide terpenes, such as limonene or pinene. Versus in the lower plant, might be more appropriate for it to put some of the bitter sesquiterpenes in to prevent grazing from forest, woodland mammals, animals, things like that. So different terpene levels in the upper versus the lower, and the terpene levels can change throughout processing. Also, when you are preparing or making your own medicine with cannabis, a lot of people bake with cannabis. You'll notice that the room starts to smell like marijuana after it's been baking for a while. Those are the terpenes in the air. They've left the plant and are not useful for medicine when they've done that. So one tip when processing and making home medicine is to keep the baked goods covered, which would be something you normally wouldn't do. Say, for example, when you're cooking brownies, you would normally have them lifted up, but it might be appropriate to cover them with foil, for example, to keep some of the terpenes in there. Terpenes are very effective, even at low concentrations. Inhalation method, we have some good human studies on, and terpenes can be effective topically and orally as well. So they're very versatile, and they complement the cannabinoids and create synergy. So we create synergistic effects depending on how we use them. Terpenes are generally volatile molecules, which means they like to go into the air. And because of that, when one is processing terpenes or even just storing your flower at home, is very important to keep them tightly sealed. Glass containers, I think, are best for this. How broad are the variabilities in terpenes, and where do you find higher concentrations? They can be quite broad, the different levels of concentrations. And if you look at any kind of the laboratory analyzed fingerprints, a lot of labs are doing terpene analysis. you'll see a pretty wide range of variables. The human smell and the palate can be very effective at detecting certain terpenes and certainly combinations of flavors. In wine, the wine tasting world, for example, sommeliers have training. And when you go to the test for the sommeliers, you're literally smelling the wine, and you should be able to tell not only what type of wine it is, but what year it was grown and what soil it was grown in. You'll notice when you first purchase something at the store and you take it home and you open it and you smell it, it might have a very powerful or pungent aroma to it. Again, the terpenes. But 2 or 3 weeks later, especially if that jar has been opened, closed, those levels can change. So processing can change it. The type of soil that is grown in can change it. Conditions of humidity and temperature during the time of growing can affect it. Terpenes tend to do well in soils with a little less nitrogen. The French have a saying about wine, to make great wine, the grapes must suffer. And I think that they're talking about real hot days, real cold nights, and some of the plant molecules in the grape, the proanthocyanidins, are much more expressed during stress. Some of the plant chemicals are more expressed during times of stress. So terpenes are quite variable, but use your nose, and the nose can become very sophisticated, and also we have beautiful laboratory analytics now. Some of the displays I've seen are quite nice in terms of gauging the various different levels. Terpene concentrations can vary, and this is one large reason why some people do much better with certain types of cannabis than others. And again, that's a very individual specific choice. So, and then on the medical side, people have very different reactions to certain types of cannabis, and a lot of that is the terpene profile. So understanding as a consumer, either a recreational consumer or a medical consumer, what works for me, what doesn't work for me, that takes a lot of time. It also takes experimenting with a lot of different products. Botanical medicine is a much more fuzzy kind of a slow medicine, and it does require a lot of time, and it requires at least somebody helping the patient who knows what they're doing, who can make proper suggestions. The patient can do a lot on their own through diaries of dosaging, strain selection, etc. But a lot of the time an expert can sometimes be very helpful to make suggestions, and the terpenes are a good example of this. Huge variability, not only even within similar chemotypes of the plant, but also within the same plant itself. And then the cannabis 1 week is going to be a different type of cannabis 2 or 3 weeks later, especially if it is dry and exposed to open air, and a lot of the terpenes can escape. Terpene production is more genetically than environmentally determined, so strain is very important, and cloning can produce similar results, but there is an environmental component. Terpene production increases with light exposure, so think of wine being stressed in the heat of the sun, kind of a thing, and decreases with soil fertility, but it does increase. Terpene yields are higher when the plants are deprived of nitrogen. So to maintain tight tolerances, good manufacturing practices, like you would a pharmaceutical, for example, cannabis does require the vegetative processing of the plants to really have tightly controlled temperature, light, and humidity. The more sophisticated recreational grows are definitely doing a lot of this. Home grows maybe not so much, but realize that there are environmental factors that definitely do affect it, and that also genetics are the same. So again, protecting your phenotypes, sharing that genetic information is an important part of the terpene, whole terpene profile. So when we look at studies, we know that rodents, laboratory animals, show there can be actually pretty profound effects on their activity. You can have the animals in a relatively lethargic state, and you can introduce terpenes, and you can observe increases in movement and movement patterns. Very obvious, and this can happen in very low concentrations. So that definitely suggests a pharmacologic effect on their nervous systems as low as 5 nanograms per ml. And then we also see positive effects at undetectable levels in the blood, which could be because the terpenes, even though they come in at already low concentrations, they distribute pretty widely in the body. If it's in the nervous system, they really go into the lipids pretty quickly. So the body can absorb a lot of the terpenes and take them right out of the plasma, but we can still have effects at very low concentrations. Some studies show strong serotonin activity, which could be partially responsible for the effects on mood, pain, and sleep. And we see this a lot with some of the, quote, indica strains. And just a caveat, we know that we're going to be changing that nomenclature soon, but certainly some types of cannabis will make people much more sleepy than other types of cannabis. A lot of this is involved with the terpene profiles. I think that when we have an educated palate, we can learn to smell the types of cannabis that tend to work best for us. Some people will notice that they do much better with certain types of strains than others. And again, back to the genetic component, a large part of terpene production is genetic. So utilizing genetic information can potentially be helpful for folks as well. The terpenes, we'll start with myrcene. Myrcene, also known as beta-myrcene, is a terpene that is common to a lot of other plants. Lemongrass has high levels of myrcene in it, as do mangoes and hops. Hops and lemongrass are known to have sedative and relaxing effects, and hops is actually a cousin of cannabis in the plant world. So when combined with THC, especially, there's a synergistic effect with myrcene, and it really can help produce sedation. Myrcene is one of the molecules responsible for couch lock. So for those people who really like an indica to really get into their body and feel relaxed, that a lot of the times is a high myrcene component. It does have some pretty remarkable physiologic effects as a standalone molecule. It's anti-inflammatory through prostaglandin pathways. So anytime you're using an anti-inflammatory approach, there are different inflammatory pathways, and when you hit more than one, you have this potential for synergy as well. So also, in addition to an anti-inflammatory, is a good pain reliever. I mentioned the sedative aspects of it. It is a muscle relaxant. In animal studies, myrcene blocks liver cancer from forming. This is, I think, really interesting, and we will attach a pretty technical link to a pretty technical article on terpenes and liver cancer. I'm not suggesting that that's the case, but just in terms of liver protection, thinking of medicines, we normally think of medicines as things that hit the liver hard. Acetaminophen, Tylenol, for example, can literally cause liver cancer. This is a pain-relieving molecule that actually in animal studies is preventing it. So, and again, potential for synergy with other pathways, whether that be for sleep induction or for pain relief or for muscle relaxation, for spasticity. This is a pretty good molecule and is shared by a bunch of other plants. On that line, sometimes it could theoretically be much cheaper to get terpenes from, say, lemongrass or mangoes than it would be to hunt for a cannabis plant and try to create one that's super high in a certain level. Sometimes I recommend that my patients would enjoy like a mango smoothie or a mango drink with the cannabis, or a lemongrass tea along with the cannabis. There are ways that we can utilize these chemicals very affordably from other plants, because cannabis is still a pretty expensive plant if you think about it. D-limonene, also limonene is what it's called. This has a very lemony smell to it. So even something like a lemon fresh pledge, something that kind of smells clean and bright. We know in human studies that we can take depressed patients, we can put them in a room, we can expose them to the limonene at very low levels and measure their depression on something called a Hamilton depression score. And you can literally see the before and after their scores, the scores on the depressions are reduced. They also reduce their use over time of antidepressant medications. We see a lot of folks changing their medications with cannabis. I recommend any antidepressant drug to be done under the supervision and care of a physician. But what the science is showing is that this terpene is actually having an effect. Limonene is a very potent antidepressant through inhalation. What I like to use the lemon fragrances for, or if people are having a bad reaction to THC, a lot of the times the lemon can kind of lift them out of that dour mood. I don't know if you've ever had an experience of trying a particular strain and then all of a sudden you're in a bad mood or you're worried about something. That may or may not be this, but if you see that same pattern happening over and over again with the same strain, that could be indicative. One thing that can be very helpful are some of the lemon flavors with that. Limonene does affect serotonin pathways, so there is a mechanism that physiologically makes sense why it would be having these anti-anxiety properties. It can help with GERD. Topically can be helpful against acne bacteria. And in laboratory and cell tissue studies actually causes breast cancer lines to self-destruct. So it literally turns on an auto-destruction program in the breast cancer cells. Again, not in humans. We need more study. And I find it to be very synergistic, especially with THC, for folks who tend not to like THC but may need a little bit of THC because that helps with their pain. Is a good terpene to have for daytime use. Pinene. Pinene is one of my favorites, not because of what it does, but because I can just smell it so easily. So a lot of the times I don't even need a lab to know that it's there. It is anti-inflammatory through prostaglandin pathways. It also acts as a bronchodilator, which means it opens the airways, which can be good for asthmatics, especially good for folks who may have trouble with inhalation, a pinene-oriented product where they want to do inhalation might make that a little bit better. Pinene does aid in memory. That's one of the places where I think it can be most useful. People who tend to get a little dumb or stupid when they're using too much THC, the pinene can kind of help neutralize that along with the CBD. And it does aid the memory as an acetylcholinesterase inhibitor, so we know the mechanism about that. So when I think of pine, when I smell pine, I'm thinking, oh, that's good. That the THC high is going to be more tempered, less of a stupefacient, less likely to take the IQ down. Beta-caryophyllene. Beta-caryophyllene, the evolutionary function of this terpene, is the plant uses it to stop itself from being eaten either by insects or even mammals, herbivores. And at the same time, there is a predatory lacewing insect that when it smells beta-caryophyllene, it's attracted to the plant. So it's actually repelling the insects that it doesn't like, and it is attracting the insects that eat the insects that it doesn't like, kind of like a ladybug will take care of insects in a beneficial way. Very common to black pepper. Beta-caryophyllene is a terpene that is common to black pepper. and also Copaiba balsam. It has a good anti-inflammatory activity at low level and can be good in a topical product. Linalool is a terpene that is common in lavender. And many people are familiar with lavender. It's become very popular. Lavender pillows, very nice, relaxing smell for a lot of folks. It's believed that linalool modulates glutamate and GABA neurotransmitters, so largely responsible for some of the anti-anxiety effects of it, and also it is a sedative on inhalation in a rodent model. So we talked about earlier on limonene in a rodent model getting the animals to move faster. The linalool will slow them down. And it is an analgesic via adenosine receptors, so is working on a different pathway from the prostaglandins that a lot of the other terpenes run on. I think of this as a sedative, something that along with myrcene can really help with a couch lock. And again, the terpenes can be present in the cannabis plant, or they can come from another plant, such as lavender. We don't necessarily need to have them together. I don't recommend this, but some folks will actually some folks will actually sprinkle in a little bit of lavender flower in with their smoke to add a little bit of a flavor. I don't know very much about the smoking of lavender, but from a terpene perspective, that certainly would make sense on one level. But again, a regular lavender diffuser in the atmosphere, or even a lavender candle or something like that, can have a positive influence in the room for patients or recreational users who are using cannabis. Again, this is something that tends to be calming and sleep-inducing. So think couch lock, think sleep aid, that kind of thing. I do think we have a shortage of experts in the field, and this specialized knowledge is important too, because it's not about whether or not cannabis works a lot of the times, it's how to get it to work better or best. And when we have a shortage of experts, the market doesn't behave like it should, because the consumers are not experiencing the positive effects that they could be experiencing if they are getting good education and good advice. And again, this being a plant, it's a very fuzzy thing, as you can see from all the information in our videos here. Little things make a difference. So what is important is quality of products, good selection of products, folks who can make good recommendations for those products, and then consumers who are educated enough to make intelligent choices to choose product A, B, or C and to try them out and see which one may work best for them. So I do think that the whole industry suffers with a lack of expertise, and I hope that part of what we're doing here is to kind of raise the overall level of awareness so that people can make good choices out there for this botanical. So again, with botanical medicine, there are so many things to consider, and it is not so much having an ideal perfect product, but having the patient be aware and be able to make choices and adjustments. So again, knowledge is a very critical thing, and that's one of the things we're here doing at Medical Marijuana 411.